We just want to make it easier to be healthy and see your physician.
The patients say that this is the best doctor's visit they've ever had, and they didn't know a doctor's visit could actually be enjoyable. The Emory PCPC is Emory's patient-centered primary care, and the way to sum it up easiest is to say that it's the ideal of primary care. Here you really have a primary care provider that you can call your physician.
It's important to have a primary care physician mainly as your #1 doctor that you see. It's the person that has the whole picture in mind. Prevention is very important to overall health. Without prevention, you don't have health. You only have response to disease.
I was going to a doctor for a brief period of time that I liked a whole lot, but he left town and he referred me. He said, "I think you will really like them. I think you would like Dr. Higdon," and that has worked just really great for me.
From the minute you walk in the door, I feel like everybody from the person that greets you at the door, from the person who escorts you back to the room and checks your blood pressure, to the doctor, to the person who checks you out, I feel like I'm treated not just as a patient, but as a person.
The fact that they all work together minimizes the amount of time that you have to sort through information and/or people.
The team here is very important. It includes not only your physician, but includes nursing staff as well as medical assistants. We also have behavioralists and nutritionists available for our patients.
Having team-based care really has made a difference in my work life. I feel like it's just so much more fun to be practicing in an arrangement where everyone has the same goals.
We also have redefined what access is. So instead of the traditional office visit being the only time that you access your physician, we offer opportunities to access your physician and your team through telephone visits and through email when appropriate.
The patient portal is a lot like online banking, where you log on to a website to open up your access to your medical record. But what you also have is a way to interact and send messages to our team.
It's just as simple as logging in to your email address.
They can get their question to us, we can answer it in a timely manner, and then they don't need to worry about it, which may cause an office visit that's not necessary, or even an ER visit.
The responses that I've gotten, I've used it several times, and I get responses usually within 30 minutes to an hour. And so I think that the access is really what sets us apart from other clinics.
Coming here is easy. It is just easy, so it's not another chore you have to do.
There are no long waits for the doctor, and they have plenty of time to answer all of your questions. It's not the typical waiting area. You know, it's like a lounge.
When I come into the patient room, one thing I've noticed is that the nurse or whoever brings me in here doesn't say hop up on the table. They say have a seat on the couch. And so it's much more relaxed and comfortable.
Anything that we're doing, we always ask the question, is this better for the patient? Is it better for the patient to wait for 30 minutes while I have my patients stacked up, or is it better to work my schedule around patients' needs?
At Emory Patient-Centered Primary Care, I am heard, seen, and responded to.
At Emory Patient-Centered Primary Care, we're transforming the way you experience healthcare.